Welcome to this explainer. Okay, picture this. You've just walked out of a chiropractic clinic feeling absolutely fantastic, like you're walking on air. But then you wake up 3 days later feeling like a stiff board just because you fell asleep wrong on the couch. Sound familiar? Well, you are definitely in the right place. Today, we are unpacking exactly how to safely maintain your spinal alignment right in your own living room. See, there's a pretty harsh reality in spinal health we all have to face. Your adjustment works in the clinic, but what you do between visits determines how well it holds. We really only spend a tiny fraction of our lives getting professional care. The rest of the time, we're navigating the daily grind. We're slumped over desks, commuting in our cars, carrying kids, and sinking into overly soft couches. All those daily habits can undo the benefits of your professional care in a flash. What you do in the margins between those visits is what literally makes all the difference. All right, here is our roadmap for today. We're going to hit 1. Why exercise, 2. Lower back relief, 3. Neck and upper back, 4. Core work, 5. The role of massage, and 6. When to seek pro care. Let's dive right into section 1. Why exercise? Specifically, why are we doing these supportive movements to support your adjustment? It really helps to think of your spine like a building under renovation. Professional adjustments are there to fix the foundation, but your at-home exercises, those are the scaffolding. They are supportive tools designed to keep those crucial muscles active and hold everything right where it belongs. But keep in mind they are never a substitute for treating a true structural problem. Moving right along to section 2, lower back relief, focusing on decompression and stabilization. We're starting here because your lower back honestly carries the heaviest daily physical load of any part of your spine. First up for the lower back is the knee to chest stretch. Now, instead of getting hung up on perfectly counting your reps, I want you to imagine wringing out a tight sponge. By gently pulling one knee at a time toward your chest, you're actively decompressing that lumbar spine. You're just melting away all that intense pressure that builds up simply from standing and sitting all day long. So have you ever noticed how your lower back naturally tends to arch off the floor when you lie down flat? The pelvic tilt is what fixes that. By actively tightening your abs and pressing your lower back firmly into the floor, you're waking up those essential core muscles that have basically been asleep while you were sitting at your desk. These guys are the unsung heroes that stabilize your spine while you move through your normal daily life. Our third lower back movement is a classic, the cat-cow. As you gently alternate between inhaling to drop your belly and exhaling to round your spine, something pretty amazing happens mechanically. You are safely restoring mobility in both your lumbar and thoracic spine, all without putting any downward compressive weight on your sensitive spinal discs. It is pure movement without the penalty of gravity. Let's transition up the kinetic chain to section 3, neck and upper back, and how we counteract forward posture. These two areas are intimately connected. Tension in your upper back is inevitably going to pull on your neck, and vice versa. Now, this brings up a question patients ask all the time. What is the absolute best exercise for neck pain at home? And honestly, the answer usually surprises people, mainly because it's not stretching your neck forward. The answer is the chin tuck. You aren't tilting your head down, you are just sliding it straight back. Think about this. The average human head weighs about as much as a bowling ball. When you lean forward to stare at your phone, that weight multiplies, which is exactly what causes this modern epidemic of forward head posture. This quick 5-second hold directly fights that strain. And you can actually turn that single chin tuck into a total powerhouse routine by pairing it with 2 complementary upper back moves. First, slow, controlled shoulder rolls release the trapezius tension that drives those stubborn tension headaches. Then, there's the doorway chest opener. Just gently leaning through a doorway stretches out the chest, perfectly countering that rounded shoulder posture that's secretly adding extra weight to your cervical spine all day. Moving right along to section 4, core work, we're talking about your deep spinal stabilizers. The surprising truth here is that deep abdominal strength is the main factor in actually taking the physical load off your vertebrae. Take the bird dog, for instance. Extending an opposite arm and leg while keeping your hips perfectly level, well, it might just look like a simple balance test, but it is incredibly strategic. It trains your absolute deepest spinal stabilizers through balance and muscle control, totally avoiding any direct compression on the spine itself. Similarly, we've got the dead bug. By slowly lowering the opposite arm and leg while actively fighting to keep your lower back glued to the floor, you are building ironclad core strength. Honestly, for anyone dealing with a highly sensitive lower back who still desperately needs to build stability, this right here is your safest, most effective go-to move. Okay, let's pivot in section 5. We're shifting from our active at-home routines to what happens back in the clinic, specifically the role of therapeutic massage for treating the soft tissue layer. We have to admit, there's a fundamental ceiling to what we can achieve at home. While daily exercises are amazing for movement patterns and activating muscles, therapeutic massage operates on a totally different level. It reaches the tight bands, the sticky adhesions, and the deep circulation restrictions in the soft tissue that stretching alone just simply cannot break through. Think of chronic tension like a tight knot in a rope. If you just pull on the ends by stretching, the knot often just gets tighter, right? If you stretch every single day and a muscle just keeps tightening right back up, that stubbornness is a direct signal. Hands-on soft tissue work is required to literally untie the knot so your at-home exercises can actually do their job. And finally, let's move to section 6, when to seek professional care to find the structural source. It's absolutely crucial to know your safety net and precisely when to hit pause on the DIY treatments. Look, there is a very distinct line between normal muscle stiffness and severe structural warning signs. If pain is radiating down an arm or a leg, if you feel numbness or tingling in your extremities, if you get sharp pain with specific movements, or if a dull ache just won't improve after a few weeks of effort, at-home exercises are no longer enough. Your body is waving a massive red flag that it needs a professional's eyes and hands. When you do step into a clinic like Hickok Chiropractic, the guessing games finally stop. Instead of blindly trying to manage your pain on your own, you'll undergo a full health history intake and a hands-on physical exam by Dr. Jason Haycock to physically locate the exact origin of the pain. The entire goal is to completely explain and understand the mechanics of your injury before a single treatment proceeds. But for those of you just doing standard maintenance, I want you to burn this number into your brain. 5. That is the minimum number of days per week you should perform your at-home spine exercises. Because consistency beats duration every single time. Doing 5 short, highly focused sessions a week is going to preserve your clinical results far better than doing one occasional hour-long stretching marathon. So, as we wrap up, I want you to take a hard look at your current daily routine and ask yourself this. Are you just trying to manage your daily symptoms? Or are you actually ready to treat the structural source of the problem? By combining targeted at-home exercises with proper professional care, you can stop just surviving the day and actually start thriving. Thank you so much for joining me on this explainer, and I really hope this empowers you to take decisive action toward your long-term spinal health.